It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hi again, everyone. I'm Candace Kruger along with Jim Knox, and we're back again with another edition of the Best Docs Network, featuring some of the best doctors in all of the Dallas-Fort Worth area that are helping to change people's lives.
Exactly right, Candace. Like our first doctor, world-renowned doctor, Dr. Clay Cockerell.
You know, we tend to think of athletes as being healthy people. They're out running or lifting weights or wrestling or whatever they do. But surprisingly, there are a number of conditions that are more prone to develop in athletes, depending on what kind of sport they engage in. One of the reasons is they may be in an environment where they're very close to other people that may be carrying a bacterium, for example, like staph, so they're prone to get boils and sometimes cellulitis and folliculitis. So that's one thing that can happen. There's also sometimes herpes virus infections, especially in wrestlers. There's a type of herpes called herpes gladiatorum, which is due to their touching one another in a wrestling match, and one spreads the herpes to another one. Fungal infections too. They get hot, sweaty. The skin, especially in runners or people that are in hot, warm environments, the skin chafes, and then fungus can set up shop there. They can get a yeast infection or can get so-called jock itch, which is due to ringworm type of fungi. So those are all things that we see fairly commonly in athletes. Yeah, athletes can protect themselves if they use careful skin hygiene. So in other words, for wrestlers, for example, they need to make sure that they use a good antibacterial type of wash very frequently, especially after they've wrestled and ideally before they wrestle. So if the wrestlers are all doing this together and they're keeping the gym clean and all this kind of stuff, the chance of spreading those kind of infections is certainly less. As far as trying to prevent things like ringworm, it's good when you're getting hot and sweaty, to let that area kind of cool down, take a cool shower, let the area air dry so that it doesn't really just stay hot and macerated and whatnot. You think you might have one of these infections, athlete's foot or jock itch or whatever, probably the first thing you can do is maybe just try something over the counter. There are things like antifungal preparations that you can buy at the pharmacy. If it's not getting better within about a week or so, probably ought to call it to the attention of your dermatologist, have them take a look at it. They can do a scraping or possibly even a skin biopsy. Even though in a young individual that's got the predisposing factors, that's going to be by far the most common cause. There are some other things sometimes that can look like fungal infections that are more serious. So you wouldn't want to let it go too long if it didn't respond pretty quickly to treatment.
Prosthodontix is the name of the specialty, and it's one of 9 dental specialties recognized by the American Dental Association. It's a specialty that requires 3 years of additional training at a dental school level. It's 3 years dedicated to the specialty of prosthodontics, which is reconstructive dentistry, including dental implants, crowns and bridges, dentures and partials, some TMJ treatment, and other small areas of dental reconstruction that most people will never need. A typical patient that finds our practice has needs ranging from fillings all the way up to full mouth reconstruction. We handle everything in-house. By having everything in-house, we have total control of patient outcomes, and that's our main goal here, is to have fantastic outcomes. One of the biggest strengths of my practice is the amount of time we spend with each patient. It's all about education here. Every new patient is scheduled for 1 hour, and we go through their complete diagnosis, their treatment plan, and we attempt to educate them on all the options that are available. And it's one of the things that I enjoy the most about my practice, is getting to know the patient and helping them understand their problems, but also giving them several different options on how to fix their problems. We often have multiple try-ins so that we don't just make the patient look good, but we make them look fantastic because we've taken the time to pick the right tooth size, tooth shape, and tooth color that fits their complexion and their facial shape. Another way that my practice significantly departs from common implant treatment is that I do everything myself. I do the planning, I do the surgery, I do the teeth. It's all me and my hands fabricating these restorations for the patient. There's not a laboratory technician that comes in during the procedure, and no one else touches the patient's care except me. We're committed to patients having long-term success, so we do provide all phases of services, including cleanings and maintenance. Often I frustrate my patients because I'm so picky about their outcome that we sometimes have to make changes or we have to redo the restoration if I'm not satisfied with it. But it's important to me that we get it just right for every patient, whether it takes extra time or not.
For additional health information, be sure to check out our Healthy Living blog for the best tips, latest medical procedures, and up-to-date news for modern medicine at our website at bestdocsnetwork.com.
I woke up on a Sunday morning and I had this awful pain. And it was like I was hurting everywhere. But I knew it was like my head and my balance. I couldn't get my balance. So I told my wife, I don't feel good. I think you need to take me to the hospital. Went in and a surgeon on duty examined me and they gave me CAT scans, and when she told me that she saw a mass in my head that weren't supposed to be there, and she couldn't tell me exactly what it was, but she wanted me to see a neurologist.
He was having some problems with not only headaches, but not being himself too. Ultimately, he got seen by a neurologist who did an MRI, who discovered the very large tumor, and he was placed on seizure medications and referred to me for resection of his tumor.
Yeah, you got a big one there. She said, but we can handle this, you're gonna be okay. And she started drawing. She drew my skull, and she drew where the tumor was, and she just went to work, and she drew that entire table with pictures of how she was gonna go in and cut it and get it out.
It was very unusual for us to find one that large and that had been that locally destructive of so much of his tissue that it ended up requiring so much more in terms of reconstruction. Because it was not only just the resection of the tumor that was so important in him, but we needed to give him back normal contours so that he looked normal in public after the surgery.
Knowing that she was confident and she knew what she was doing, and everything she told me, that's the way it came out.
And he's been doing very well for many years now. We've never seen any signs of any residual tumor. He sees us about once a year and is doing very well and enjoying a very active lifestyle and enjoying his retirement.
I'm blessed. And every day we wake up, I think about her. She did it, you know. That is, that's my way of telling it. Here we are 7.5 years later, you know. That's my best buddy.
We are here with one of the best doctors that specializes in the back and neck. He is a pain management specialist, a board-certified physician that treats problems with the back and neck. And some of your patients that come in, what are the most common symptoms?
Well, patients that come into my office often complain of neck pain that may or may not be associated with arm pain, numbness, or tingling, or shoulder pain, numbness, or tingling. They also might be complaining of thoracic or mid-back pain that may or not be associated with numbness, tingling, or pain radiating around to the ribs. Most commonly, they come in complaining of low back pain that may or may not be associated with leg pain, numbness, or tingling, or otherwise known as sciatica. What we find out is, upon evaluation of these patients, that this procedure addresses these conditions such as a herniated disc, a bulging disc, scar tissue that might be in the spine, from trauma, or even patients that have already had a surgery on their back and or a fusion of their back that still can be treated with this minimally invasive procedure.
Dr. Williams is one of the only specialists in the world that does a minimally invasive procedure that can detect and treat neck and back problems. Explain this procedure.
What I do is I make a very small 2 to 3 millimeter incision in a natural opening above the patient's tailbone without damaging any bone. It also has a laser, a state-of-the-art laser, and a high-definition camera that I can drive up to the patient's, into the patient's spinal canal and examine the patient's spine for herniated disc, bulging disc, scar tissue, inflammation, and then treat that patient's pain or a condition right there.
All right, Dr. Williams, so I have the procedure on my back or neck. What about the recovery time? How long?
Well, I'm glad you asked that, Jim. Since it's such a minimally invasive procedure and an outpatient procedure also, I usually can have a patient back at their desk job or office job the next week after they have the procedure.
All right, there he is, Dr. Jason Williams, the go-to doctor when it comes to back and neck problems. All right, thank you, doctor.
Thank you so much, Jim.
Before I went to see Dr. Swanson, I had just had a baby. I was 26 and found out that I had gout. Woke up one day and couldn't walk. My feet hurt horribly and went to my doctor, and she ran some tests and it came back that that's what the problem was. And she told me that basically the easiest way to get rid of it was to lose weight.
Megan Zarella, she's a relatively young girl who significantly overweight. She was in her 20s and she didn't have diabetes or high blood pressure, but she knew that she was in trouble because of her weight. She did have gout, and that causes joint pains and flares up when you eat certain things. And we know that, that doing weight loss surgery can help that. So she was real interested in not only being able to be more physically active, but also in helping out with those joint problems that she had.
Well, I was 250 pounds, so when I went to see Dr. Swanson, he said that I was actually a really good candidate for the weight loss surgery, and we talked about which procedure I'd want and discussed what insurance would cover, and decided that the gastric bypass procedure was the best thing for me to do.
So she had a gastric bypass, and she's just done really well with that. She's still relatively early in the game and is continuing to lose weight, but she's done very well.
Since the surgery, especially now that I've lost so much weight, energy levels are through the roof. As far as my gout goes, I have been symptom-free since surgery. I haven't had any issues at all. I came off all the medications I was taking. The overall experience with this has been very positive. It's not easy. It takes a huge commitment to stick to it. When I see the results I have, I wouldn't change it. I wouldn't go back and do anything different than I have.
Don't forget, for more information on any of these outstanding doctors you see on today's show, head to the website, bestdocsnetwork.com.
That's right, we're gonna head to our next best doctor. It's pain management specialist, Dr. Cesar Duclair.
I had gone through 2 major back surgeries. I have a lot of bolts and screws and nuts and squirrel cages and fusions in my back. I have had a terrible time with all of the pain I experience in my everyday living. I lived on pain pills and my quality of life was awful. I wasn't the guy I wanted to be for my family, for myself, so I needed another way of life.
Greg is a prototypical guy. He hurt his back doing some heavy lifting. He ended up having a spine surgery, and he ended up having a second surgery. And when he came to me, he was very disappointed with the results of his surgery. He was almost at the end of his proverbial rope, feeling that there was nothing for him.
He said I was pretty screwed up. He said my back was quite a mess. He went back to the original x-rays and took me through this, and I went through a lot of spinal injections. He had recommended we did those, and they gave me some temporary relief, as he said they would. The pain would come back, and so we got into the next phases of doing the spinal cord stimulator.
That is an electrical device that is implanted in the spinal canal next to the nerve roots that are causing their pain. It produces a sensation of pressure or tingling in the areas that they typically have pain. The brain actually pays attention to that pressure, that tingling sensation, more than it does the pain. So they actually don't feel as much pain, or sometimes no pain at all, from those typical areas.
I take and I turn it up, I put it on, and I turn up the volume, and I sit for 5 minutes or 10 minutes. That's better than taking the pain pill because I can manage my pain much better. I really do have pain freedom when it comes to working with the operations. And I'm very, very pleased with where I'm headed.
I had no energy. I was limp. I just barely could put one foot in front of the other. Every day was just a difficult day to get through. All I wanted to do was just to crawl into bed. I was so tired. I was also having some heart palpitations and flutters, and that was scary. I could tell something was wrong. So I went and saw Dr. Worrell.
Sleep apnea is really sleep apnea with hypopneas. There are two different parameters we look at when we're doing sleep studies as far as sleep disordered breathing. There's the pause in the breathing for 10 seconds, which constitutes an apneic episode. In a hypopnea, you don't breathe well enough to get proper ventilation and your oxygen level actually drops. So for people who every 2 minutes don't breathe well enough to ventilate their body, then we call that a severe sleep apnea. Severe sleep apnea is associated with various kinds of heart problems.
Dr. Worrell suspected that I probably had a form of sleep apnea, and he prescribed a sleep clinic, and it came back that I was borderline. So we waited for a little while more and did another one, and finally it came back that I was full-blown sleep apnea. And they, of course, said, you've got to have a machine.
A CPAP is kind of a necessary evil sometimes. Some people will adapt more easily than others, and for those who do adapt to it, they are the ones who are the most appreciative because they see the quality of life improvement. They wake up and they're not so achy, not so stiff in the morning, that they have more energy, more stamina, that they just feel better overall.
Within 2 weeks of getting a good night's sleep with a CPAP machine, I was back to 100%. I was like, it's a miracle. It's just absolutely a miracle. I think Dr. Worrell is probably the best doctor I have ever gone to. He partners with you for your health issues. He's not condescending. He listens and very, very gently pushes you in the right directions that you need to go for your health.
There is nothing good about a sunburn. Not only does it hurt, but it can make your skin leathery, thick, it can increase the number, the size, and the depth of wrinkles, and it can cause skin cancer. That's really bad. You need to use a sunscreen when you're out in the sun for prolonged periods. SPF 30 is about the ideal number. A lot of people use an SPF 40, 50, 60, and 80, but you really don't get much bang for your buck after SPF 30. So just get your SPF 30 going, apply it every couple of hours while you're out in the sun, especially if you're in and out of the water. Make sure your kids have the SPF 30 sunscreen on regularly also. People with red hair, blue eyes, and freckly skin have a much greater incidence of skin damage from the sun. Also, if you're on certain antibiotics for urinary infections or respiratory infections, that can sensitize you to the sun and you can get a sunburn far more quickly and far more deadly than you normally would. So protect your skin. The sun's your friend, but it can also be your enemy.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education, and the Medical Minute tab. Don't forget, for more information on any of the outstanding doctors you see on today's show, head to the website, bestdocsnetwork.com. Right now, it's time to head to our next best doctors, Dr. George Farhat.
Well, in going to my regular MD, I was getting chronic headaches, and we couldn't make them go away, and we wanted to lessen that pain, and obviously not have that. It was hard to focus, hard to concentrate at work, and as a salesman and a general manager in business, one of the things that I wanted to do was be able to focus and pay attention to my customers and to my business associates. We came to Dr. Farhat so that he could look at all of the things that were going on in my body.
Degenerative disc disease and arthritis are a common reason behind low back pain. I've known Paul for almost 10 years now. Paul is an active man, he played sports, he's an avid golfer, he golfs all the time. When I saw him initially, he had pain in his lower back and down his leg. And there's something special about Paul. He doesn't like to take medications at all for his conditions. He wants to come in, he wants to be treated, get well, and move on with his life.
When I came to Dr. Farhat, one of the things that we wanted to accomplish was how do we reduce the pain, but not necessarily have surgery or a long recovery process. So one of the things that we talked about is the injection process that we've been going on since I've been seeing the doctor for almost 10 years now.
What I've been doing for him over the past 9-10 years or so, every time he gets a major flare-up, we'll set him up for a simple procedure called epidural steroid injection in the lower back. And usually he gets several months, sometimes a couple of years of relief after the procedure. He'll go back doing whatever he was doing before, and when his pain flares up, it becomes intense, he'll call us back, he'll come to the office, and we'll go back and do the same routine on him. I can say that we were able to help Paul achieve his pain freedom, so he can go back to the same activity level he always has, and go back playing golf and doing whatever he likes to do in life.
Dr. Farhat, to me personally, has become a friend as well as a physical consultant to my body. He shows by his demonstration of actions how he cares about Paul Williams and who I am, what I do, and how I feel. And it's given me something that's very key to my life and the quality of my life.
We're all different. We like different things. But one thing nobody likes is pain, especially when it keeps us from doing the things we love. Luckily, PAMA's here. Whether it's back pain, carpal tunnel, foot and ankle pain, or more, PAMA physicians are dedicated to their specialties and dedicated to your quality of life. Don't let pain keep you from doing the things you love. PAMA, pain freedom.
I was kind of up against the boards with the puck, and a player from the other team was coming in to body check me, and you just sort of brace yourself against the wall, and he literally just hit my elbow, and the boards were here, and it just popped. It didn't hurt right away, but I knew when he hit me, it was just an awkward feeling. Puck kind of went away from me, and as soon as I was out of the play, I pulled my glove off on the ice, and I looked down, and it was, at that time, my hand was sort of a couple inches over.
Imagine getting hit so hard that every ligament that holds your wrist in joint gets torn and your wrist dislocates, pops completely out of joint. Those are very hard injuries to come back from, especially if you're a high-level athlete.
We have trainers and trainers' assistants and people like that that, you know, have seen lots of injuries, and they were all just kind of like, oh boy. So I got the feeling that night it was sort of beyond sort of a physician that was at the game. And as an athlete, you're always thinking, well, is it serious enough that I can't play? And I found out it was serious enough that I wasn't going to play for a while.
But he came in with an unstable wrist that wasn't staying in joint, and we had to try and address that in order to get him back to activity, basically get him to be able to bear weight at all on that wrist again. When you get hit that hard and you get that much ligament damage, all the ligaments kind of fold over on each other and crumple together, and they're not in a good position to heal. In order to get this injury to heal, you have to rearrange everything and bring the ligaments back out in line so they can heal and get solid again. And we were able to do that in a minimally invasive technique through a little telescope in the wrist joint. And what we did was we realigned all of his ligaments, cleaned out all of the torn and dead tissue that was in his joint, and then put his joint back in place, and then put a pin across it just through the skin in order to hold it in place to allow all the ligaments to heal.
Scarring wise and stuff like that, just incredible. Couldn't be happier. You wouldn't know if I didn't show you the other one, I guess.
It was a successful procedure, it was a successful recovery, and we accomplished our goals of giving him pain freedom.
We are 1 million strong. We are united behind a cure. There are over 1 million colorectal cancer survivors in the United States. My name is Charles Kelly from Lady Antebellum, and I'm in this fight against colorectal cancer because it actually hits pretty close to my family. My father-in-law was diagnosed with it, and the thing about this disease is it is preventable, and so I encourage everybody to go get screened. Let's beat this thing.
I came to see Dr. Shaw. I'd had 2 surgeries already, both failed. The first was a laminectomy after injury at work, and the second was a fusion. And after the second operation, the surgeon had pretty much done his part and felt like I should be pain-free. So our discussion was, I don't feel very well, I'm still hurting, and he said, you shouldn't be, I've done the surgery. So that's sort of how we left it. So then I went looking for a pain specialist.
Many of our patients referred by primary care doctors or internists have back pain. Some have not had back operations. Some have had 1 or more back operations. And we spend a substantial amount of our time caring for people that have had previous spinal surgery and are the same or worse after their spinal surgery.
The first consultation with Dr. Shaw, we talked about what are the choices other than surgery. So rehabilitation was one, injections were one to the area that was been affected, and then a host of medications. And so we really set off on a multi-tiered approach to deal with all of those things.
With Mike, he was in such discomfort that he could not perform his job well. Had he given me extra time prior to his 3rd spinal operation, I believe that he would have been better off quite more rapidly than we've been able to achieve after his 3rd spinal operation.
One of the things that I really like about working with Dr. Shaw is that we're able to set up some type of goal when I came to see him in the practice initially. I want to be free from the pain, free from the medication. And so pain freedom is a big deal to me, and it's a big deal to Dr. Shaw.
If one sticks with the conservative model first and then goes to the more invasive model, you don't burn any bridges to trying to feel the best you can be as soon as you can get there. Sometimes when we reverse those actions, it slows down or intensifies your recovery. And perhaps, in Michael's case, you don't achieve all of the goals that you could have achieved had you not had the procedure, that is, the operation.
That'll do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best doctors in all of the Dallas-Fort Worth area that are changing people's lives.
And for more information on any of these outstanding doctors, head to the website, bestdocsnetwork.com.
And as always, if you have a question or comment for us, we'd sure love to hear from you. Send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.